Hi there. I was saying, do I have to use that? And I whispered it, and he's back there going, yes. So welcome to Open Enrollment 2015. So my name's Denise House. I'm with GBS Benefits. Probably remember me from past years, and here I am again. We have great information for you. We've got some changes, good changes, and so we'll go through all of that right now. Open enrollment, we kind of tell you every year, this is an opportunity when you can change plans, add or delete dependents, make any changes you want. Open enrollment starts today, and we're requesting that everybody make their changes no later than November 21st. Okay, so that includes flex spending. In the past, we have allowed flex spending elections to kind of carry into a couple of weeks into December, and we're asking that all of your elections, including flex spending, get submitted by the 21st. Your benefits are effective January 1st. Once you've made those changes, you cannot make any changes unless you have what we call a life event. And you probably know what those are: marriage, divorce, birth of a baby, adoption, or loss of coverage. And I like to highlight loss of coverage. Let's say your spouse covers you on coverage and you don't take the county's insurance. You can jump onto the coverage if they lose access to coverage, as long as you do it within 30 days. Okay? So I like to make sure you're aware of that. So what's new? We're changing medical carriers to Cigna. We've been with Altius for quite a long time. We've done a lot of research. We're thinking it's a great option. They've got really good resources and tools, and we'll educate you on that. We're offering two plans, the traditional plan and the qualified high deductible plan. On the traditional plan, I want to point out that it goes through the Open Access Plus network. That's that you would look. So if you look at, if you look on the Cigna website, you would make sure that you're looking at providers under the Open Access Plus network. And that's their biggest network. Vision exams are covered at 100% up to $60. Want to highlight that for you. Chiropractic care, they are covering $40 per year, per calendar year. Your prescriptions are generic $5. You can see Tier 2 is 30%. Minimum you're going to pay is $30 to a maximum of $200. That's on Tier 2. Tier 3, it's a 50% benefit, and you have a minimum maximum on that. It's $50 minimum, $2 max. And a Tier 4, which is specialty max medications, that's a 20% benefit. The max you're going to pay is $150. And those are the real expensive medications, kind of thousands of dollars. Also want to point out that home delivery, if you decide to go through home delivery, that's 2.5 times your copay. So there's a little savings there. Emergency room, it's a benefit of 20% after deductible. So you're encouraged to use urgent care. I understand there's not urgent care in this area. Jenica was saying in the prior meetings that that's going to be something that's going to be introduced here shortly. And as soon as we're aware of what those urgent cares are, she'll send out an email and let you know. Qualified high deductible plan, we're offering the qualified high deductible plan. That's the second option, and the benefits are very similar to what we have today with the Altius plan. Wellness, we're introducing wellness this year. We're really excited about it. That's brand new, and you'll see in your booklet you have handed out, we have what we call a wellness rate and a non-wellness rate. So towards the back of the book, the last 2 pages, you'll see what your premiums are for the wellness and the non-wellness, for traditional and for the qualified high deductible plan. Okay? Anyone participating today on the qualified high deductible plan, you have Health Equity as the administrator for your HSA. With the change to Cigna, the HSA administrator is going to change to Bank Corp. Okay? So if you are going to participate again in the qualified high deductible next year, and you want to transfer your money, and that's what's recommended because Cigna works with Bank Corp, there is a transfer fee of $25, and the county will pay that for you. So what I recommend is that you wait until your membership has been set up with Cigna. You can call Bancorp. They'll send you a form and help you and support you to get that money transferred over to Bancorp. The county is putting in a very generous amount into your HSA, so if you choose to go on to the qualified high deductible plan, if you enroll as single, they're going to put in $1,125. Two-party is $1,687.50, and for family, it's $2,250. And they'll split that up into 2 payments, so half in January, half in June. Okay, and again, that's very generous. I very seldom see a group participate as much as they are with the HSA. And then on the Employee Assistance Program, that's being offered through Cigna, and you've got 1 to 5 face-to-face visits, and that's per person, per issue, per year. So if you're depressed today, just depressed, and then the next issue is you're dealing with teenagers. Those are 2 different issues, and you can have up to 5 face-to-face visits with a counselor. You also have access to an EAP or Employee Assistance Program 24 hours, 7 days a week. So that's good. Healthcare reform. You hear about healthcare reform, Obamacare, every day. We are now all required to have health insurance. In 2014, you see what that penalty is if you don't have insurance. It's going up quite a bit for this next year in 2015. And you're being offered qualified insurance, so you don't need to know about this, but I like to educate you on it. You may have someone you know that doesn't have access to insurance. The marketplace is going to be opening again in November, that they can go in and shop for insurance. Now, if you were to say, you know what, I want to go look and see what those benefits are and what the rates are, you can, but because you're offered a qualified plan through your employer, you would not be eligible for a subsidy, okay? But if there's anybody you know that needs to have access to the website, it's www.healthcare.gov. So I would encourage them to jump onto the website and they can shop for insurance. Prescription costs, as you know, that's someplace where I think we can be more of a consumer. I always like to remind you to, compare cost, have a generic prescribed if possible. If you have a new medication that's being prescribed, ask your doctor for a sample. Oftentimes, they do have samples that you can try for a week or so to make sure it's going to agree with you. And then remember last year I introduced the GBS comparison tool. And in your book, that is on page 8. And I'm going to go through that in a minute. I want to make sure you knew that was in the book. Some ways that you can save money with pharmacy. These are some suggestions. Of course, using generic. Manufacturer coupons are often available. Pill splitting. Not every medication can you split the medication, but ask your pharmacist. Okay, is this a medication that we can split? You're going to double your supply, and you're going to pay that much less as far as your copay. Specialty drug assistance programs, those are often available. Look online, especially for those more expensive medications. Mail order. Make sure you're looking to see if you can do your mail order medication and save a little bit on copays. And of course, compare your prices between pharmacies. Okay? And then I talked about the comparison tool. Again, that's on page 8 of your book. It kind of walks you through how to get this set up on your smartphone. Hopefully everyone has a smartphone. If not, you can do it from a computer. You're not going to go through the App Store. You're going to go into our website, which is this www.gbsbenefits.com. You put that RX icon on your phone, and the next time you go in, you can put in your zip code or your city that you're in where you're filling your prescription, and it will price out for you the different cost at the pharmacies in your area. So you may not see a considerable savings, but if you have 1 or 2 medications a month, that will add up. So I highly recommend that you use this price comparison tool and hopefully save some money. The comparison tool is not meant to replace your insurance. It's meant to complement and give you a little bit more insight on different costs. If Cigna has a limit on a medication as far as supply, or if they require pre-authorization, that is still necessary. If you use your coupon, you pay for your medication up front. So on some of these medications, you see that you will use a coupon. You'll hand that to the pharmacist. If you use the coupon, you'll want to send that into the insurance carrier. You'll send that into Cigna. And if you pay the cash price, the pharmacist is able to submit the claim just like they do today with your insurance. Okay? So hopefully that was a good recap. I'm going to turn the time over to Kathy, and she's going to go through the specifics of Cigna.
I think I need the mic. All right. Thank you, everybody, for coming. I have the clicker. So first of all, I want to tell you a little bit about Cigna. Cigna's network is called an Open Access Plus network. It is a coast-to-coast network. So what that means is, how many of you in the street travel? Outside of the state? Really, one person? 2, 3, 4, okay. If anybody's traveling outside of the state and for some reason something happens, right? A kid gets an ear infection or you fall and you need stitches, typically on most other carrier plans, you're going to have to go to an emergency room or an urgent care, right? And it's still going to cost you a lot of money because it's out of network. Cigna's network, because it's coast to coast, you could call the 800 number on the back of the card and you could ask to find where an urgent care is, or a primary care physician that might be able to see you if it's during work hours, right? And you could see a provider at an in-network level benefit, right? So that's good stuff, because then you're paying a lot less money than you would if you were out of network, right? Because typically out of state, it would be more money. So we call that network an an Open Access Plus network. So when you're looking for your providers, and you can look on Cigna.com until your plan is effective, you can look there. You want to make sure that your provider is an Open Access Plus or an OAP provider. In addition to that, when you ask your provider, hey, do you take Cigna? Those really aren't the best words to use, because anybody will take any insurance. What you want to ask is, are you a contracted provider? Which means, have you contracted with Cigna? Are you getting discounts? And are you passing those discounts back to me as a member? Okay? So you need to ask if they are a contracted provider on the Open Access Plus network. Okay? So there are 2 plans, a traditional plan, which we call the OAP plan, which is a copay plan. You have to meet your deductible. So if you're an individual, you have to meet a $1,000 in-network deductible. And we're only going to talk about in-network because I really don't want you guys going out of network. Why? Because it's going to cost you more money out of pocket, right? If you are a family, you would have to meet a $2,000 deductible. And then the max amount that you would ever pay on a plan is, if you were an individual, you'd pay $4,500 or $9,000 as a family. Okay? And there's no limit now to the amount of coverage that you get. There used to be limits. Like if you had, say, a cancer claim, right? It could be $1 million, depending on the type of cancer, the type of treatment. And they used to cap it. Now they don't do that anymore. Then the HSA plan, how many of you are already on an HSA plan? Okay, a couple people. So it takes a lot of time to get used to. I had to do it too. I had to change the way that I think about how I want my care to be, okay? So the thing with the HSA is you pay first money out. So let's say you go to a local provider here, and it's not your preventive care. Let's say that you go for the flu. And the total cost at the discounted rate is $130, let's say, for that office visit. You have to pay that all out of pocket, okay? But it's going to go toward your deductible. Once you meet your deductible, the plan pays at 80%, right? So that's good stuff, because it's really not very much money, all things considered, okay? Feels that way. It feels really tough, I will tell you. It's a hard thing to get used to. However, if you're really super healthy, or you're really sick, or you have a condition that requires a lot of money out of pocket, that's where you weigh in, right? You're either super, super healthy and you never need to hit it, or you have a condition where you're going to hit it really fast and then you're going to let Cigna pay, right? Because why wouldn't you want Cigna? Right? Okay. Talk about the prescriptions. So tier 1 drugs are drugs that have generic drugs. Okay? Tier 2 drugs are what we call name brands, which are typically drugs that have been out for a while. Tier 3 drugs, I like to call them the bathtub drugs, right? Because when do you see those? 9 o'clock at night, they've only been out for a little bit. They probably cost a lot of money because they haven't been out very long. So I call them the bathtub drugs, right? They are tier 3. They're going to cost you a little more money out of pocket. That's why you pay 50%, and then at a minimum $50, but a maximum of $200 per member. The tier 2 drugs are drugs that used to be in this level. They've been around for a while, right? And so they cost a little less to produce. So that's how much then you only pay 30% with a minimum of $30 copay and a max of $200. And then the tier 1, right? These guys have been out there for a while and they've created some generics. Sure enough, you could pay $5. Now, if you could get the drug for $4, what are you going to do? Get the drug for $4. You have the choice, okay? Now, tier 4s are specialty drugs. Those are like rheumatoid arthritis, MS drugs. They can be in upwards of $5,000 a month, okay? So if you are on the HSA plan and that's how much, think about that. You only have to pay 20% of the cost up to $150 max. That beats $5,000, does it not? I'm going to help you with the math. Yes. Okay. Now, if you have a maintenance drug, how many people are on maintenance drugs? Don't know what kind, but just maintenance drugs. Okay. Maintenance drugs are things that you take every single day. You have to have them all the time. So if you go through our mail order pharmacy, you pay two and a half times. So my son's on a generic version of a face med. You know, he's got all sorts of acne. So you pay 2.5 times that $5 copay. It's about $13, $12.50, right? For that, and you get a 90-day supply. Okay? So utilize that wherever you can. We will talk a little bit in a minute about the tools that Cigna has available on the website to help get you through the plan, so you know the resources that we have available for you to work for you, to help make you better consumers, to keep money in your pocket, right? The HSA, you have to hit your deductible first, right? So you're going to pay that, whatever that cost is, out of pocket. And then once you meet your deductible, there's a copay for each one of those, 10, 25, and 50, depending on what tier that they're in. Okay? Preventive care. Preventive care should cost you how much money when you go to the doctor? Come on, it's written right there. It's just nothing. Okay? It's free, right? Because what we want is we want you to go every single year to make sure you know exactly where you are with your health, right? If you go 2 or 3 years in a row to your doctor and you have your cholesterol, let's say, under control, right? Then that's good, because then we can watch it, we can maintain it. If it upticks, then we know what the difference is, right? Well, you only go every 5 or 6 years. We don't know. Doctors don't know. And then what happens if you have a $125,000 heart attack claim? Your money out of pocket. It costs you nothing to go to make sure that you're healthy, right? So do that for yourself. Plan pays. Cigna pays for that to happen, right? Because the plan pays. Okay? We don't charge anybody for that. So your primary care, yes?
Preventative care, would that be like just a regular physical, mammogram for women?
Yes.
Can you give some examples of preventative?
So those are it. Flu shots, immunizations. There is a list in your booklet.
Okay.
Yeah. There's a list in the booklet right after the benefits, so I don't know exactly what page it's on, but it will give you a list and what is age appropriate, right? So if you're lucky enough to be over 50, then you get to have colonoscopy, right? That's a bonus. So with that being said, right, your colonoscopy will be covered at 100%. However, how many people want to go in, have a colonoscopy, then find a polyp, and then you have to go back a couple weeks later to do it again? If anybody says that they think that would be fun, we need to have you checked out. Okay? So if you go into a colonoscopy and it's preventive, right, you're thinking you're going to go in and there are no polyps, it will cost you nothing. However, if you go in for a colonoscopy and they find a polyp, they're going to remove it right then and right there, right? Because you only want to go in once, and then the diagnosis is going to change, the coding's going to change, and then it's not going to be 100%. Okay? That is one example where that is very clear, that you would go in maybe thinking it won't cost you any money, but you would come out knowing, but they got the polyp, right? Okay, so now if you go in for your preventive care visit, right, your annual visit, and you say, hey doc, I got this mole right here. And the doctor says, hey, looks like we probably ought to take that off. Not preventive anymore, diagnostic. Okay, so the code changes, and then we pay it differently. So ask your provider, okay, if you're going to remove this, are you going to put that separate from my preventive care? Ask the question. Okay? Sometimes they'll be like, oh yeah, we'll just do this piece that's all preventive care, and we'll set that to Cigna with the preventive care codes, and it won't cost you anything, but your mole removal will be separate. Okay? So ask the question. It's all based on code. We also know that Jane in the back office that put in the code to send the claim over to Cigna may have put the wrong code in. Oops. Now it looks like what you thought was going to be covered at 100% isn't. Don't panic. Just tell us. Hey, really, seriously, they told me it was my preventive care. I called my doctor. I asked them. We can reprocess the claim. Okay? Don't wait until you go to collections. Call us as quickly as possible, because we understand people make mistakes and people in back offices mistype and something happens. Okay? So don't panic. That's why I'm here. We're here to make sure that those get easily taken care of. Okay? Specialty office visit is $35. We already mentioned about urgent care, but let's say you're traveling, right? An urgent care visit may only cost you $45 out of pocket, or an emergency room is going to cost you 20% after you hit your deductible. Okay? So be mindful. All I'm saying is be mindful. Call Cigna if you're not sure. They can help you with providers. They can help you with locations. They can help you with facilities. Okay? We have 24-hour line that can help. It's the member services number, which will be on the back of the card. So we have plenty of tools to help you out. Please feel free to utilize them. If you have questions, please contact Denise and your HR department. We'll be happy to walk you through it and help you with those, okay? We talked about health savings accounts, right? They're usually a little higher deductible, lower premiums. Of course, we always cover preventive care, and we cover it at what?
Nothing.
Nice job. We have a really strong network. Cigna has a really strong network that we've already talked about. The tax deductible deposits in your tax savings on the HSA account are beneficial to you. Take pre-tax dollars are put in there for you. You can grow it and save it, right? So if you're super healthy and you're putting money into your HSA account and then you get to retirement age, you can take that out with no tax penalty. Then you can buy the big TV that you want. But before that, you can't do that. So how much can you contribute if you're an employee only or a single, $3,350? If you're a family, it's $6,650 max per year. So the way to enroll, right, you're going to put your HSA option of the two plans on your enrollment form. Will help establish that HSA bank account, which is your account. You get to take it with you. Then you can add additional contributions should you choose to do so. And then you can expense out any qualifying expenses which are government-based, right? And then you can watch your account grow. And like I said, what if you're really healthy this year, you save a bunch of money, next year you're skiing, you blow out your knee, you can use the money, right? So that's, at least you have a little cushion for expenses. So on the back of your booklet, the very first number is unfortunately incorrect. So this number, this 866-494-2111 number, will be the member services number on the back of your card. That's the number that you can use to talk to somebody 24/7. I think I forgot to mention this in the last meeting. Number 2, there's a 24-hour nurse line. So my husband, although I love him to death, he's sick all the time. Makes me crazy over little things. So he got a flu shot. For him, weird reactions, and he got the shakes, and I didn't know what to do with him at 11 o'clock at night. So I called the 800 number, asked for the nurse. Somebody walked me through the process of making sure that he was okay, what his symptoms were. We talked through it. Another time he had this huge coughing fit. I had to call. They told me what to do with him, right? Nothing illegal, just so you know. So that member services number, 24-hour nurse line's attached to that. Please utilize that whenever you can. I really did, for as much as he makes me crazy, I was happy that I didn't have to leave the house and that we could take care of it. And they would advise if they thought that it was something worse than that. Then, once you get your ID card, you will have a website personalized just for you. You use your ID number that's on your card, you register. It will show you everything associated with the account. We'll show that to you in a minute. Once you're registered online for that, how many people here have a smartphone? Yep. Then you can download the app. I said smartphone, I didn't say smart user. Right. Okay. So you online, and you can download that app, and it'll have everything with you. So we'll go over some of those items. This is what the website looks like. So you can view and track your claims. You can get your drug cost estimates. So let's say your doctor prescribes you something, and you want to know how much it's going to cost, what tier it's in, right? How much money you're expected to pay. You plug that information in. It'll give you the name of the drug, the dosage, the number of times a day you take it, and then it'll tell you of the pharmacies that you've picked in your area based on your zip code or whatever, that where you can get it, and how much it'll cost if it becomes a maintenance med, and how much it'll cost if you get it through the online or for the home delivery service. Okay? You can do the same thing with procedures. So if you have to have a knee surgery and you need to decide between two facilities, maybe your doctor performs surgeries at two facilities and you want to know which facility might cost less for a procedure, it's going to do that for you, right? It's all about cost savings. It's all about you being thoughtful and mindful about where your money's going. So for an example, in Denver, which is where I'm from, in Denver, if you were to have an MRI at a hospital, it costs you about $1,600, $1,700, $1,800. maybe, give or take. But if you go to a freestanding facility across the street, it costs you $700. Okay? Well, don't you want to know that? Don't you want to know you can save that kind of money? That's a lot of money, right? So utilize these tools to be able to make better decisions for yourself and keeping money in your pocket. Sometimes you don't have a choice. I understand that. But at least try, right? This is the app. So what it does is there's a dashboard here. It will tell you how much, if you choose the HSA, it's going to give you a balance all the time, so you can track that pretty readily. You can, these are really hard to see, but they're claims, drug costs, your wallet. It will give you drugs. So like I put in my kids and my husband and put in all the meds that they take. So the acne medication went in there, the blood pressure medication went in there, right? Do I have to remember it now? Nope. If something happens, I can pull up my app and I can pull up my people, right? And I can show the docs what it is they're taking. And then I don't have to remember it, right? It's on you all the time. ID card.
Ran out of juice, huh? You choose 5 parts. It is a safe. If you choose the high deductible plan, added it here. So if you enroll on the high deductible, between your savings and what the county count as a single, you're almost taking care of your deductible. Okay, two-party, you can see is $2,255.80, and family, you are taking care of the family deductible. Okay, one thing to note is, remember, the county's going to pay half of that into your account in January and half in June. Okay, so remember that. So, just as a review, we kind of have talked about what a HSA is for the past few years. I'm going to review. This is for you and or your employer to put money into your account. I just showed you what the county is going to put into your savings account. That's to pay for your qualified expenses, for your money out of pocket, okay? I love this illustration because this really shows you the difference. If you enroll on the traditional plan, which you can, you're going to pay that much more premium, okay? So the premise is why not have a little savings, put that into your savings account, that's your savings account for life, you never lose that money, and pay a little less to Cigna. Cigna's a great insurance carrier, but why not pay them less and put some money into your savings account? This is your savings account, you never lose that money. Once the county puts that money into your account, you don't pay it back. Okay, so you understand that? Any questions on that? Okay, so the HSA requires you to enroll on the qualified high deductible. So you could say, you know what, I really like the traditional plan, but I want to be on the HSA. The two go hand in hand, okay? The high deductible is a lower premium, somewhat of a higher deductible, and then the administrator for the HSA is Bancorp. And that's a change from what we have today. We have in place right now Health Equity, and this will be now with Bancorp. On the HSA plan, once you pay your deductible and you're out of pocket, your plan then pays 100%, okay? I think your maximum liability on a family is $6,000. I'm saying that off the top of my head. Is that correct, Kathy? Maximum out of pocket for a family is $6,000, is that right?
Yes.
For the high deductible? So that's the maximum you're going to pay in a year, okay? So on the qualified high deductible plan, until the deductible is met, you will pay your cost out of pocket, okay? So if you go to the doctor, you go in for tests, prescriptions, you're going to pay those costs up to the deductible amount and then the out-of-pocket amount. You still have insurance. It's still going to go through the insurance. You're going to have an ID card. You're going to give it to the doctor or whoever's providing the service, and they're going to file the claim into Cigna. And you're going to get the discounted rate. So when you receive an EOB, you see the EOB, and let's say the doctor's billing for like $150. The insurance reduces it based on their discounted amount, and you're going to have that filed into the insurance, and you're going to pay the discounted amount, okay? Most preventative services, Kathy reviewed with you, are paid at 100%. IRS dictates how much we can put into our savings account on an annual basis, and this does include what the county's putting in. So if you decide this year, you know what, I really think I want to join the high deductible and establish my HSA. As an individual, the most you can put in there is $3,350, and that's with what the county is putting in. So you need to make sure and keep that under that amount. Okay, that's the maximum you can put in there. And then two-party family is $6,650. If you're over 55, you can do an annual catch-up. If you, the owner, is 55 or older, you can do an annual catch-up of $1,000. There's a bonus for being over 55. So what is a savings account? Okay, tax-free. All the money that goes into your account is tax-free. Any interest that you earn when the money's sitting in that account is tax-free, and any money that you pull out for qualified expenses is tax-free. You never pay taxes on this money, okay? Everything that you accumulate continues to build in that account if you don't use it, and it goes and it rolls over from year to year to year. So, you know, this is the third year, I believe, that we've been offering the HSA, so you could probably look back and see how much your expenses have been, and maybe you'll have, if you do the math, you would have had, you know, quite a bit of savings in that account. You never lose it. If you leave the county, that account goes with you. You own that money. So if the county's put money into your account, you leave, you're no longer employed here, that account goes with you. You never lose that money. It's flexible. You become the owner of that account, and you can use it as you wish as far as spending the dollars in that account. You may be a person that says, you know what, I'm going to pay for this doctor bill and I'm just not going to get reimbursement. Some people use it that way, and maybe for a rainy day we'll pull money out of that. As long as you have receipts to substantiate those costs, you're good to go. Okay? Ownership is by the employee. You keep the account. You never lose the money. If you pass away, that goes to your beneficiary. Okay? So who's eligible for an HSA? You have to be enrolled in the qualified high deductible. You have to be at least 18 years or older. You cannot be enrolled on Medicare or TRICARE. You cannot be claimed on someone else's taxes. If you're filing jointly married, that's fine. And you cannot have any other health insurance. So if your spouse works somewhere else and they offer a traditional copay plan, you cannot be double covered if you're on the qualified high deductible plan. Your spouse, your dependents can be double covered. I usually don't suggest the two coverages because of accounting and all the kind of the troubles that come with having two coverages, but that is allowed. So what are the advantages of the HSA? Remember, the funds roll over year after year. You never lose the money. Tax benefits, as far as any money that goes in the account, any money that comes out, as long as you're using it for qualified expenses, you never pay taxes. Portable, the funds are yours. That's your savings account for life. Flexible in funding, so you have flexibility. You could say, you know what, for the first 3 months I'm going to put in $500 a month, and then on that fourth month you could say, you know what, I'm going to back off and just put in $25 a month. I have enough money in the account, I feel like I'm okay. In case we have any expenses, then I've got the account established. And then again, remember, the county's going to fund those amounts halfway in January for you. Okay? I know oftentimes people are concerned because they have a medication, they have costs coming out of their pocket initially, and they're concerned about not having any money in the account. Remember, the county's going to fund half of that amount for you. You can make changes. You can do a one-time rollover from an IRA. So if you have an IRA, you can actually fund your HSA with an IRA. No claim substantiation. So again, I talk about the FSA in comparison. On the FSA, if you go to the dentist and submit a claim, a lot of times they'll question that claim and want to make sure that it's a qualified claim. With the HSA, the only one that's going to ask you for receipts is IRS. Okay? Long-term investment opportunities, and it provides control over your health care dollars. Meaning, again, you could just be paying money out of your pocket and not want to pull money out of the HSA. You can totally use the account that way. The eligible expenses are exactly the same eligible expenses as you know with the FSA. So your doctor visits, medical equipment, chiropractic care, dental, vision, medications, includes some over-the-counter, which again has to be prescribed just like the FSA. So again, kind of as a review, you have insurance. If you choose the high deductible, you go to the doctor, show your ID card. They'll send that claim into Cigna. You'll ask that they do that so that you know what you actually will owe once they've discounted the claim. Pharmacy works the same way as you know today. The difference is you will pay the retail cost at the time of as you're filling the prescription. So if you think, you know what, I really think we should jump on the high deductible this year, if you have ongoing medications, do me a favor, do your homework, make sure you know going into it what those costs are. You may be surprised and not really have a real expensive medication. On the other hand, there are really expensive medications out there, so I want to make sure that you know going into it what those costs are. Disadvantages of the high deductible: no first dollar coverage. So in other words, you're going to pay the cost, remember, except for preventative. As long as it's a preventative visit, you're going to have 100% coverage. But again, remember, there's no coverage until your deductible is satisfied. If you enroll as a two-party or family, you will be responsible to satisfying the family deductible, and that's different from the traditional plan. You can only use what's in your account. So that's different from the FSA. On the FSA, you set aside $2,000 in day one. If you have a service, you can use that $2,000. On the HSA, you do have to have the money in the account. And again, remember, it's not compatible with other traditional coverage. Okay, that was a quick review. Has anybody got any questions on the high deductible and the HSA? Okay, turn the time over to LJ, and she's with Dental Select. She's going to review Dental Select really quick.
Good afternoon, everyone. Thank you for taking the time to be here, and we appreciate you continuing your dental insurance with Dental Select. You have your information in the packet or up here, so I'm going to briefly go over it really quick. You still have the same plan. The network is called the Platinum. So when you go to their website, you can go to dentalselect.com. You'll see a blue upper tab that says Find a Provider. You can click on that. And we have about 2,300 providers in the Salt Lake and surrounding area. It does allow you to go out of network, so I'll go over those benefits. Or if you don't have access to a computer, you can always call our member service team. We'll be more than happy to email you, fax you, or mail you a provider's list. You do have an individual deductible of $25, family deductible is $75, and that deductible only applies towards your basic and major services. It does not count towards your preventative. Your maximum, what this means is this is what Dental Select will pay out each calendar year. You're going to start off at $1,200. Okay, it's a rolling maximum. So each year that you're with us, we're going to increase that. And if you can see down below on that dark brown, we're going to increase this the second year by 100. So that will make your maximum 1,300. Then the second year, we're going to add another 2. It'll increase it up to 1,500, 1,800. Then it will cap out at 2,000. If you continue to stay with Dental Select. You can go to our website, dentalselect.com, to go into members. You can create your password and log in, and then you can see what your maximum is, or you can give our member service team a call. Your preventative, which is your oral examination, x-rays, fluoride, is only for children. We'll cover that at 100%. So try to go 2 times in a calendar year. So if you go in network, there's no out-of-pocket cost for you. If you decide to go out of network, then it's going to be paid at 100% of what we call the RNC, reasonable and customary. So let's say that you go to a dentist not contracted with Dental Select, and he charges you $100. We allow $50. Dental Select's going to pay that $50, and you're going to be balanced bill that other $50 difference. So be careful when you go out of network. Your basic, which is going to be extraction, simple extraction, any type of fillings, cavities, oral surgery would be for wisdom teeth extraction. Perio, any type of gingivitis or gum disease, and endo, which are your root canals. Dental Select will cover that at 80%. You're going to be responsible for the other 20% after you meet your $25 deductible. Major services are going to be covered at 50%. That is going to be crowns, bridges, and dentures. And if you are brand new coming on the plan, if you've never been on the plan, you will have to satisfy a 12 months waiting period for your major services. Okay? And then there is ortho benefit. There's 2 ways you can get the most out of this benefit. The first is the 20% discount. If you use one of our orthodontists, you receive a 20% discount, let's say off of $3,000. Then anyone under age 19, we're going to pay 50% for a one-time lifetime of $1,500. And then anybody's eligible for that 20% discount. There's not an age limit on that. And then it shows you up here we pay a specialist. You receive a 20% discount off of the in-network specialist, and then we're going to pay according to a general dentist fee schedule. So try to get your cleaning, exams, and x-ray 2 times in a calendar year to keep you healthy. Now, if your dentist suggests a treatment plan for you, you can always request a predetermination. That's sent over to Dental Select. Anything over $300, you give us a call, and we'll let you know what your out-of-pocket cost is going to be before you have the service done. Any questions? Yes? Yes. Okay, so again, we're here to help you. So if you have any questions or concern, please give our member service team a call. Okay? Thank you. Did I just put you to sleep? Are we all asleep now? No sleep before, huh?
No, I think Kathy put them to sleep. Okay, me again. Okay, so vision, I'm just going to quickly just remind you that we're offering Opticare of Utah again. No change on the benefits, okay? One thing I want to point out to you is the Select Network is Standard Optical. And it appears as though you have a better benefit on Standard Optical because it states covered in full and what their allowance is, and it seems to be higher. However, keep in mind that the out-of-network, such as a Costco, they have a lower, usually a lower retail cost. So you're starting out with a lower cost, and your allowance could actually be better with the retail cost being lower. So make sure and do your price comparisons. You do have a broad network in the middle there. So all I do is want to caution you that, you know, although it says that it's 100% coverage on Standard Optical, you could actually get a better price using the out-of-network provider, such as a Costco. Okay? The only difference is you will need to file the claim into Opticare for reimbursement. Okay? Basic Life, AD&D voluntary, still being offered by Hartford. The county is paying for all active full-time employees. You have a $25,000 benefit for basic. If you die by accident, it's double. Your spouse is covered for $10,000 and each dependent child is covered for $2,000. So that's the basic benefit. You also have an opportunity to get supplemental insurance that is subject to evidence of insurability. So you'll fill out a form based on your health. They will hopefully approve you. You can get as much as $600,000. Your spouse can get up to $250,000, not to exceed your amount. And they are also subject to evidence of insurability. And then your dependents can have up to $10,000 of coverage. Okay? One thing I like to make sure and remind you is to update your beneficiary. You may have had a change in life and forgot to update your beneficiary. So make sure you update your beneficiary and you have that current with Jenica. And now I'm going to turn the time over to Dave.
Great. Without the microphone.
Yeah, right.
All right. So my name's Dave. We're all awake, right? Ready to go? Because we only have one more hour, so we should be good. Just kidding. Like 10 minutes. Everybody's looking around. What? Okay, flexible spending. So I just wanted to spend a few minutes talking to you about flexible spending. So I'm Dave with National Benefit Services, and again, we're excited to be here with you to talk about this benefit. How many of you are currently participating in the flexible spending? Great, a lot of you. Excellent. So those of you who were using a card this last year, we resent some cards to you. If you didn't get that or threw it away because you didn't have any money on the card, let us know and we can get you some new cards out for the beginning of this next plan year. But if you are currently enrolled and you still have a balance in your account, you do have until March 15th to still incur expenses and get those receipts turned back into us so that we can get you reimbursed. If you are enrolled and you want to continue to be enrolled for next year, you do need to fill out the forms. I know that most of you have the pre-populated forms. Otherwise, there's some blank forms as well. Just get those completed back in so that we can get our cards and everything set up for January 1st. Okay, so flex spending, very basic, is you set money aside out of your paycheck, all pre-tax, to help cover your out-of-pocket expenses, your deductibles, your copay, your co-insurance. What this is doing, it's reducing your taxable income, so you never have to report that income. And now you have money set aside to where you can go and start paying for those expenses. Okay? The money is available to you all up front. So January 1st, whatever you elect is available for you to go start spending right away. Whether it's paying the dentist for their bill, going and get LASIK, paying for the surgery, whatever it is, you can start right away, even though the money's not yet been contributed to your account. Okay? To get reimbursed, you either pay for the expense and then submit the reimbursement to us, and then we'll go ahead and reimburse you. You can fax the receipt to us, you can email it to us, get on our website now and attach the image, or if you want to download our mobile app, just take a picture then of your receipt and it sends it right over to us. Okay, the new website, hopefully you've got some communication about the new website. You can log on. The same user ID and password you use for the website is the same one you'll use for the mobile app. Okay. Any questions about the flexible spending? Dependent care is another account that you can use through this program. If you are working and you need to take your children to a daycare facility, neighbor down the street, pre or after school care, that money can also be set aside through this program, all pre-tax, up to $5,000. Oh, and I forgot to mention the great news that the IRS gave to us a couple days ago. The $25.50 is now what you can elect for the health flex spending. Okay. Any questions about those two accounts, flexible spending or dependent care? And the last thing I want to mention is with the health savings account. If you guys are participating in the high deductible plan, decide to contribute to an HSA, you're not eligible to participate on a traditional FSA. Okay? Those two don't work well together, right? What you can do is sign up for a limited purpose FSA. That would be for dental and vision expenses only. So if you know you've got dental things coming up or you want LASIK or need glasses, you can still put money aside in the flex. It's just limited now to just dental and vision only. Okay? Any questions? Excellent. Thank you.
My turn. Thanks. Okay, so just a couple things. First of all, if you don't know which plan you want to go on, HSA or traditional, I've set aside some time the next 3 weeks to talk to you one-on-one. So if you want to come to my office, you just need to call HR and schedule an appointment. And we'll go through both plans with you and see which one's going to be cheaper for you. I can't make the decision for you, but I can lay it all out for you on both plans. That does require a little bit of homework. You need to find out those prescription costs if you take them every month. You can call the doctor and ask them sometimes what the adjusted rate is on a high deductible plan. So just need to kind of do some homework first. Washington National Insurance is here to talk to you about the cancer and accident insurance. So I'm going to give him about 5 minutes to just go over that really quick with you.
Okay.
There's the microphone.
You need to clip me. Where does this go? Oh, this
Yep, you hold that.
getting wired up.
That's really quick. So
Pocket.
yeah.
I'm coughing in the mic.
Yeah, that's fine. Okay, let's try that.
That'll work? Okay. Hello, folks. I'm Patrick Howard with Washington National Insurance Company. I remember most of y'all. I think most of you, a lot of you are already with us. Washington National is about a 104-year-old company. We take care of your supplemental insurance benefits on payroll deduction. And this has nothing to do with any other insurance that you have. All the benefits are paid directly to you over and above, in addition, on top of any other insurance that you have. And some of you recently have been using the accident part. And if you quit work, change jobs, or retire, you get to take this coverage with you at the special group rate that you're going to get, because every so often we send you a check for every single penny that you pay into this back to you, minus any claims. So let's say you pay that much in and we pay you that much in claims, you get that much back and starts all over again. If you need it, it's unlimited. So it's a win-win deal. It's a good way, good fun way to save money and still have that peace of mind that's priceless, knowing you have unlimited financial help. It's not if you need it, it's when you need it. Okay? So with that being said, I'm going to get right into it. I'm going to show you that, well, most of us have major medical insurance through our employers. You know, it's paying the doctor bills, hospital bills, and medications. And a lot of us have this type of insurance, Middle America does, to help us out financially on paying what they didn't pay, plus help us with some wages. And the price of these gets higher and higher every year. I'm going to show you the cancer one first. This seems to be everybody's first concern. This is from the American Cancer Society's facts. They basically tell us cancer hits about 1 out of 2. It's a number 2 killer. It's the most expensive disease out there. Excuse me, and a lot a lot of the times people have to take off work, trips to and from. That's out-of-pocket money. So that's why most people carry a cancer plan, because it pays over and above in addition. And so me and my wife, one of us is a target on this. So that's why people have it. The guarantees from Washington National, I'll read some of these. Money's paid directly to you regardless of any other insurance that you have. Your benefits are never reduced as you get older. There's no lifetime maximums on many of the benefits. The premiums don't increase due to age. You're guaranteed renewable for the rest of your life, so you can take it with you whether you're in here or retired. You can't be singled out for a rate increase. And then our world famous return of premium. On the cancer plan, they have a first occurrence. If you have internal cancer, they have a first occurrence amount. They'll pay you up to $10,000. You can select which, from $1,000 to $10,000, which one you want. You call me, I take care of all the claims, or Michael, my assistant, and if I got to work till I die because I'm still raising kids, so I'll be available. If I'm dead and gone, we have a health advocate that will take care of all your claim issues and help you as well. And it pays you when you go in the hospital from the very first day. You get paid up to $12,000 a month. You have a daily diagnostic testing and doctor's visit amount. We pay for all your transportation anywhere in the United States, whether you take an airplane, train, bus, drive your own car, every time coming and going, up to $3,000 round trip each time for you or the sick person and a family member to go with you. A lot of times with cancer, you got to go out of state and go to the specialize in that type of cancer. So like Boston, there's a doctor getting famous up there for pancreatic cancer. He used to take us out. Now you can go up there and he's healing them or getting them well. And prostate, Atlanta, Georgia's got a doctor getting famous up there with no side effects. MD Anderson in Houston, breast cancer. So you might have to go out of state, even though we got a good facility there in Salt Lake, Huntsman. But there's no limit to the number of trips. We'll even send you and your spouse or a family member to the National Cancer Institute for consultation where you can weigh your options. We have a lodging benefit paid for 60 days each time, and an ambulance benefit as well. So everything I just showed you, your major medical really doesn't pay anything on. What they do pay, it's sent to the providers. So, on a real-life cancer case, you're going to have to come up with some of this money for sure. And where do you go? Savings, retirement, stuff like that. So we got that taken care of. Where we pay the most is from this point on, because everything's paid in or out of the hospital. We got a second and third surgery opinion. Your surgery with anesthesia pays up to $9,375 per operation. There's no limit to the number it pays in or out of the hospital. Reconstructive breast surgery, actual charges, blood and plasma, prosthetic devices, whether they're surgically implanted or not. Pays on radiation and chemotherapy in or out of the hospital or self-administered. And there's no monthly or lifetime maximum limit to this benefit. There's a daily limit amount, though. And by the way, we're going to have brochures and prices for everything. We're right outside the door down the hall, so you can get a packet with brochures, and we'll answer any of your questions. And if you want to sign up, it takes a few minutes. Pays on comfort drugs, stem cell transplant, bone marrow transplant, wigs and hairpieces, skilled nursing facility, hospice for the terminal. That just allows you to upgrade to a nice private suite type setting in your final days than that freebie that you get. We have alternative care if you want to try something new or different on the market. That's the cancer plan right there. The next part, we have an intensive care rider that hooks onto the cancer plan, and the pricing's on that as well. It's something you'll find in very few policies written today. If you're your spouse or your kids, and by the way, the kids are covered up to age 26. If you get the family plan, whether they're living at home or not, they're covered at 26. But if you or any family member going to intensive care, critical care, coronary care, burn wing of a hospital for any reason whatsoever, the adults get $500 a day, the kids get $750 a day. If it's a vehicle accident, that's our most popular intensive care claim, it doubles. So the adults get $1,000 a day, the kids $1,500 a day. So that's a good that's a good feature right there. It also pays on subacute intensive care, a daily blood and plasma benefit, and an ambulance benefit as well. So let's say me and my wife and one of my kids, we're going downtown Salt Lake to do some shopping. Boom, we get in a car wreck. We're laid up in ICU for 10 days. What's this thing going to pay? That's $10,000 for me, $10,000 for her, $15,000 for the child. $35,000, that's some pretty serious money, so it comes in handy if you need it. You just hope you don't use it. The last part's for accidents, and this pays you. You're covered every second of the day, on the job, off the job. Even if you get injured on the job and workman's comp's paying you, we still pay you the money. The checks come to you. We don't coordinate benefits with workman's comp or any other insurance, so you get paid just like you expect to. The claim on the accident starts at $230, so if one of your kids, let's say they fall down, you think they broke their hand, your doctor's next door, no, it's not broke, you know, you'll be okay, go back to school. We send you $230. Of course, if the hand was broke, it's $1,200. You go in the hospital, more money, surgery, more money, just okay. So all the procedures, you get more money out of the deal. And just call me, or you'll have your brochures, and it'll tell you exactly what we're going to pay. And so I'm going to go right down the list here. Accidental death. The adults, mom and dad, are covered up to $100,000 accidental death. The kids are covered up to $25,000. Dismemberment, it pays on dismemberment, fractures. If it's multiple breaks, you get paid multiple payments on that. And this is every time. So on a vehicle accident, we may pay you a dozen of these benefits. Fractures, dislocations, cuts, injuries requiring surgery, burns, paralysis. And when you have your accident and they put you in a regular hospital room, we start paying you an income of $300 a day. That pays every day you're in there up to 1 year, if need. Intensive care, you get $600 a day. And this pays in addition to that wreck I was in a while ago where we got $35,000. So if you have plans like I do, that's a 10-day scenario. Instead of 10, and 50,000, now it's $16,000 for me, $16,000 for the wife, and $21,000 for the child. That's $53,000, I believe. Again, that's some pretty serious money. If you need it, you just hope you don't. Ground ambulance, you have ground in air, emergency room services. If you're 100 miles, or if you got to go 100 miles from your resident to get care, like you're up here, you got to go to Salt Lake, we give you another $400 on top of that just for a trip charge if you drive your own vehicle. We may have a lodging benefit for family members to eat and lodge nearby. Doctor visits with chiropractor, physical therapy, MRIs and CT scans, medical appliances, wheelchairs, walkers, crutches, leg braces, prosthesis, and blood and plasma. So, and you can take part of this, some of it, all of it, or none of it. You can kind of build it the way you want to. So, any cancer, skin, blood, bone, tumor, leukemia, Hodgkin's, or any intensive care, critical care for any reason at all, any accident, we can literally pay you thousands of dollars to help with your part of the bill, as well as plenty of money to live on. The best part, though, is what happens if you don't use it. We give you all your money back. It's our 100% return of premium. I think most of you have heard how it works with the return of premium. Rider, you can receive a check for all premiums paid minus any claims every 20 years or age 75. Don't get upset for the young ones and think you're never going to get there. I'm living proof you will. I'm 64, so if I sign up today, I only got to wait 11 years. Okay, I'll be retired. No, I got to work till I die. But, you know, they just send you the money. You don't have to call and fill out a form or anything. The check comes in the mail. And you still keep the coverage at that special price, and you can collect again. We have, Mike, did you want to, no, we got the price sheets outside. Right outside, when y'all get through with your meeting, you can pick up a packet, a folder with the brochures, everything I talked about that goes into detail, and a pay sheet, a deduction sheet that tells exactly what it is. Y'all get paid 26 times a year, so it's per deduction, and we'll answer any questions that you have, okay? Or any questions now? Okay, thanks. Oh, that's fine. Yeah, it might still be wired, huh? Thank you.
That's it.
Just a reminder that Jennifer set out that sometime aside, so if you have questions, you can just make appointments. Just call the HR and we'll get you set up. Right back here, I've got the medical forms. The dental and Opticare did not change, so those you don't need to fill out unless you're making a change to your plan yourself. Okay. Thank you.